heart rate going, where's the presenter? So, so today's topic is decreasing stigma and increasing support for medications for opiate use disorders. And actually, I was thinking that I should just show you guys the 4-minute clip that I did for Spectrum TV this week. That's exactly what I was talking about, was stigma. So, but anyway, so today we're going to talk about what are the most common patient and family objections to MOUD, and to talk about strategies to increase patient and family acceptance of this as a treatment option. And so every time this talk comes around, I think, oh, you know, most people have gotten over this issue. This is not a big deal. And just this week, a patient came in 9 years sober on Suboxone. He tried to take himself off of it cold turkey because he got sick of being on it. And I was like, what are you doing? So he's like, after 4 days, I really started to feel like terrible. And, you know, he's just telling me this stuff. And I just sort of had to like call a timeout and say, wait a second, you know, what, you know, why are you doing this when you've been sober for 9 years? And he just was explaining that he wanted to be normal, quote unquote, and he wanted to be able to live his life the way he wanted to without being on this medicine. And that for almost the last 9 years, he had not even thought about heroin. And I was like, okay. So I kind of had to like set him straight a little bit. Like, is it possible that one of the reasons you haven't thought about heroin in 9 years is partly, not all, but partly because you're on this medicine? And so I turned him around a little bit, but it took a good 20 minutes of you know, talking to him about like I said, so what it is that, you know, using my best motivational interviewing, you can't accept that you need to be on medication in order to function. And he's like, yeah, that's it. You know, so then I go into this conversation about, you know, hey, I'm on blood pressure medicine. Guess what happens when I stop taking my blood pressure medicine? My blood pressure goes up. What happens when I get back on my medicine and, you know, stop eating French fries? Okay, my blood pressure goes down. Exactly. So slowly. Now, I said, look, dude, I 100% support you. It's been 9 years. You want to be off Suboxone? I'll get you off Suboxone. But let me do it really super slowly, and let's get you down off of it over a 6-month period of time. Number one, why didn't you tell me? And number two, you know, I can do this for you safely where you don't feel like you're going nuts after 4 days. So, oh boy. So anyway, that was the last time that a patient or family member in my life expressed an objection. And that was, you know, 2 days ago. And hey, after 9 years, I don't want to do this anymore. That's basically what he said. And, you know, I don't know if I could have done any better, but by the end of it, I had talked him off the cliff and he was willing to say, you know, hey, you know, I'm kind of busy right now. I'm working 60 or 70 hours a week and it's okay. And with this medicine, I am functioning after all. And maybe I can sort of chill out and slow down. And maybe in 3 months, we can start going down from, you know, 8 milligrams a day to 6 milligrams a day. I mean, it's not like the dude was on 24 milligrams. He's on 8 milligrams a day. He's been sober for 9 years. So yes, lots and lots of issues with this, right? Want to get weaned off of it. This is a crutch. Now I'm addicted to, you know, to Suboxone, and people in my life don't like that I'm on it, you know, that kind of thing. The ones that hurt me or bother me the most is when a person says that, yeah, somebody that they trust in a 12-step program says that, calls them not really sober, or the one that, you know, again says, well, oh, now that I found out that you're on Suboxone, I'm not going to be your sponsor anymore. What? So yeah, that one bugs me. But those are the types of things. You probably have similar stories with your clients. So again, what is going on here? I think in addition to what I said, which is you're just not able to accept that in order to live your life and function, you need to be on this medicine. That's where he was stuck. That was where his step one was. Like, you have to be able to accept, like, I'm a human being. I'm not perfect. I might need this medicine to help me stay alive and function. And once you accept that, then you're not fighting being on Suboxone, right? But that's what he was fighting. So I guess in addition to not accepting where you are, there's also a lot of stigma, a lot of guilt and shame, a lot of misunderstanding and misinformation. So we'll talk about those three things. So first, health-related stigma. This is actually something we do as a culture. It's a socio-cultural process in which we devalue, reject, and exclude particular social groups because they happen to have a socially discredited health condition. And stigma can manifest differently on in different ways, in different levels. There's the intrapersonal, the interpersonal, and the institutional. So the story I was telling on the news the other day was the story of casserole illnesses, right? So casserole illnesses are the opposite of socially discredited health conditions. If you have a casserole illness, if you have cancer, if you've had a heart attack, if you broke your bones, if you anything that's sort of acceptable, those are casserole illnesses. People will say, oh, I'm so sorry you're having that. Can I bring something over? Let me bring you over some food. Let me bring you a casserole. Let me bring you some flowers. Let me, take care of you. Is there anything I can do? Do you need me to go over here and go over there and do this and that? When it comes to mental illness, addiction, suicide, we're sort of like stupid. We don't know what to say. We don't know what to do. We certainly aren't bringing casseroles over to anybody's houses. And so that's exactly what I'm talking about when I'm talking about that addiction is a socially discredited health condition. It is not currently a casserole illness. Maybe one day it will be. Okay, so there's stigma operating on lots of different levels. There's the stigma that we put on ourselves, right? So and this woman, I think, I don't know, she captures it perfectly for me. She calls it the deeply rooted disdain that seems to be threaded within the fabric of my being that stagnates my progress. And so she's talking about the belief at the end about, I'm not worthy, I'm not good enough, I don't have what it takes to make it, right? So you can see that if that's how you feel about yourself, it's going to be very difficult for you to get any sort of help for yourself, right? Because if you think of yourself as, just crap and not good enough, then why would you go get help for yourself? Doesn't make any sense, right? You're not worth it. Okay, so that's self-stigma. Next level is social stigma. So unfortunately, people do decide to get help and then they get punished for it, right? Now you've gotten pigeonholed, shamed, labeled, discriminated against for life. The stigma can be worse than the illness. And also this week, I was talking with a 58-year-old gentleman who was an alcoholic, and he wasn't an alcoholic. Actually, no, 58-year-old guy that had been abusing Percocet pills for many years. And he was very ashamed about telling anybody in his life. So none of his children knew he was in treatment. His significant other didn't know he was in treatment, and he had lied and told his job that he was on a 2-week leave of absence because of his gallbladder. Okay, so not because he had an addiction to Percocet pills. That's the kind of thing I'm talking about, right? So people are doing everything they can to sort of say, I've got this other issue, but it's definitely not my addiction to Percocet pills. So sometimes once you do get labeled and be given that diagnosis of opioid use disorder, in some ways, your life may get more difficult before it gets better. So that is an unfortunate reality that a lot of our patients deal with. So, and then finally, again, is the structural stigma, which is happening usually at an institutional level. So again, as healthcare providers, when you have negative beliefs about people that have a substance use disorder or an opiate use disorder, then that can contribute to you not taking the very best possible care of them, because you figure, oh, that person's a drug seeker. Oh, they're not going to listen to anything anyway. They don't care about anything. And oh, they're just in here every other Friday with an overdose. So who cares? So again, there's that type of attitude on an institutional level, you can see how that can cause poor care. And it does cause poor care, actually. Not only can it, it actually does. So again, that stigma deters people like us in the public from perhaps wanting to support treatment, increase access to treatment. It stops people from seeking help because it prevents them from saying, acknowledging their problem, because if I acknowledge it, I'm not going to get treated well within the treatment system. And so they can't fully participate the way they would like to. So definitely have seen that happen all the time. Again, the way we've got the system set up, you get an opiate use disorder, you get a couple of felonies, and suddenly you can't get a job, you can't live anywhere. You get into enough trouble and have some evictions. Now you can't rent anywhere. On and on and on and on it goes. It's very hard to get back into life when, again, a ton of barriers are put up on the basis of you having this diagnosis. So is there anything that we can do? Of course there is. I don't know that I have a solution for the structural, stigma and discrimination, but certainly on an individual level, I think there are things we can be doing. The first thing is kind of like what I did with that guy on Wednesday is tell me more about why after 9 years, you're suddenly getting this itch that I got to be off this medicine, right? Like I could have just said, oh man, don't worry about it. Just keep taking it. And he just would have felt dismissed and things could have been disaster. But I could see in his face that he was just really upset about it. And so we ended up talking for 20 minutes plus about it. If their family is who's giving them static, then invite the family in, as long as you got permission. Are the family members willing to come to the appointment? And they'll see that, Dr. Chris really isn't a drug dealer and that she's really actually trying to help the patient. So sometimes that helps. Sometimes I have not been able to convince people, but again, you do your best. There are really wonderful testimonials. The best one that I've seen published is called In My Own Words. It's about a 17-page pamphlet where it has people from all over the country talking about their experiences, not only with Suboxone, but with methadone and Vivitrol shots. So kind of looks at all MOUD. And then again, I have my favorite 1-pager and 4-pager for how do you challenge the myths that are out there about buprenorphine and methadone and things like that. So the biggest myth usually being, oh, well, now you've just addicted me to something else. So you have to talk a little bit about pharmacology and tell that story. So those are a few ways that I have found. How do you challenge that person, who's feeling, I don't deserve this, you just basically can call it out and say, hey, it's actually okay to take something that helps you function, which I think was my patient's problem. Or say something like, you don't have to prove anything to anyone. You don't have to talk about your business at a 12-step meeting. You can keep that stuff to yourself. You don't have to be, a hero, and don't let somebody tell you that, unless you're off buprenorphine, you're not really sober. I just tell them, like, that is straight up wrong. And so you just have to correct the incorrect information. And just as far as like the internalized shame, again, I feel like I'm a broken record. You don't have anything to be ashamed of. You're worthwhile. Your life is worthwhile. I respect everything you're doing in your life to get better. You deserve better. Those types of messages that just has to be called out sometimes. So, and again, I think the best sort of testimonial is when you see people living well, right? And so that, again, I think that's why I was so shocked. Like, this guy had been living well. He had 2 jobs, he was making good money, and yet still he had these questions. So anyway, this is done by a patient of mine who has the distinction of having saved every Suboxone film wrapper that he's ever taken, because it says it reminds him of how far he's come. And so sometimes he will use those wrappers to make art. So he made this piece of art. This is what, 3 years ago now. And he called it Breaking the Chains of Addiction. And so he gave it to me. And so I have it hanging up in my home office. I don't have it at work because it's got a branded name, medicine on it. So, but otherwise, it would be cool to have at work. So this gentleman said, what Suboxone has meant to me is that addiction had me handcuffed, and Suboxone allowed me to break the chains of addiction. Once the drug stopped, I had to do what they told me to do at 12-step meetings. I did 90 meetings in 90 days twice. So yeah, he's a bit of an overachiever. Right now, I attend Suboxone-friendly 12-step meetings. Suboxone alone does not keep me clean, but gives me a better chance at recovery, along with meetings and staying busy. Medication is a great tool in my arsenal. The medication is a safety net, and it's amazing. So I cannot say it any better than that, right? The way that this medicine can help people turn their life around. It's, that speaks for itself. So just to give you a little bit of his background, he had been struggling at the time that I met him. He had been struggling with opiate use disorder for 10 years. His current dose was 6 milligrams a day. He had a history of depression and anxiety, but had not been in the hospital for over 9 years. Socially, he used to sell Xanax to get pain pills, and that's what he was using mostly. He did use, cocaine and marijuana in the past. When I met him, he was a full-time computer programmer at a Fortune 500 company. Now he actually just got a job at the Federal Reserve Bank in Cleveland, and he's like, this far away from his bachelor's degree in computer science. And so I've seen him multiple times over the last 4 years. And I last saw him, I should have updated that. I also last saw him like last week. So last saw him in August of 2021. And we were, again, talking about slowly moving him down from 6 milligrams to 4 milligrams a day. He was working on his 4th step. And he even said, okay, once I finish my bachelor's degree, then I'm going to get my master's degree. And he also has his eyes set on working at the Treasury Department in Washington, D.C. So I'm like, okay, this guy's got dreams and goals, and I just love it, right? So that's fabulous. And with his permission, one of the things that he regretted the most when he was in active addiction is that this car that he had spent a lot of time to try to, got repoed when he was in the middle of his addiction. So he lost his car. And so this was about 2 years ago. Yes, this must have been 2019. Finally, he saved up enough money to get this, brand new BMW in bright blue. So I walked with him to the parking deck, and I do have his permission to share this picture with you all. I'm like, oh my God, he got his car back. So now he's also thinking about getting another car. So I'm like, okay. Yeah, I don't need any more proof in the pudding than looking at the look on this guy's face, looking at his car and going, oh yeah, recovery works. So that always helps me remember why I do what I do. So back to the questions I asked you at the beginning, what were your patient or family members' objections to doing this thing? How did you respond? And maybe as a result of some of the discussions we're going to have today, is there a way you could have responded differently, or do you think you did a pretty darn good job? So I will stop now. Lots and lots of resources about all this good stuff.